Hi, Dr. Soparkar here. I'm going to try to tell you in 3 to 5 minutes all the essential things you need to know about thyroid eye disease. Number 1, autoimmune thyroid disorder is incredibly common. Here in the United States, roughly 1 in 5 adults, 20%, have autoimmune thyroid disorder. In fact, you will find that one of the most commonly prescribed medications for adults is thyroid hormone replacement. Number 2, Graves and Hashimoto's are examples of autoimmune thyroid disorder. This is a systemic disorder. It involves many different end organs. Number 3, thyroid eye disease are the ocular or eye manifestations of autoimmune thyroid disorder. Number 4, thyroid eye disease is a clinical diagnosis. Blood work and CAT scan can be helpful in making the diagnosis, but really it's a clinical assessment, something that somebody can tell by looking at you. The CAT scan changes are very characteristic, but they alone are not required to make the diagnosis. Number 5, there are 2 phases to thyroid eye disease, an active phase and an inactive phase. During the active phase, things are actively changing. Eyes are getting worse, but they may also be getting a little bit better. During the active phase, there are several things that can be done to quiet down the disease activity. Corticosteroids, chemotherapy, immune modulators, external beam irradiation, and most recently something called Tepezza, which is an antibody against a particular receptor in the body. During the inactive phase, things are stable. Once you get out of the active phase and are in the inactive phase, structural changes like bulging eyes, eyelid retraction, these things can be surgically fixed. Number 6, less than 5% of people with thyroid eye disease have vision-threatening disease. So it's a minority of people who really get into serious trouble. Having said that, that can be treated as well. Nobody has to go blind from thyroid eye disease. Number 7, autoimmune thyroid disorder is inherited, and it's inherited in an autosomal dominant fashion. What does that mean? That means that it had to come from mom or dad, and if you don't know who it came from, it probably came from dad, because guys don't tend to show it as much as women do. Also, it means that all of your first-degree relatives, your offspring, your children, or your siblings, your brothers and sisters, all have at least a 50% chance of inheriting it if you have it. Also, once you've inherited one autoimmune disease, you're at high risk for all of the other autoimmune diseases. Some of these you've heard of: diabetes, lupus, etc. Number 8, diet can play a significant role in the development and the management of thyroid eye disease. If you want to know more about the details of this, visit our website, plasticeyesurgery.com, and we have a whole video on dietary supplements and changes that can be made that may be helpful. Smoking. Smoking is horrible. Even third-hand smoke can make thyroid eye disease develop and make it worse. Third-hand smoke is I'm sitting next to somebody who went downstairs 9 floors, smoked outside, came in, sat next to me, and then the toxins exuded from his clothing. So even third-hand smoke has been found to be a problem. Hormonal influences such as hormone replacement therapy and birth control pills can be a problem. Also stress, and the stress can be emotional, psychological, or physical. An accident can precipitate thyroid eye disease. The last point I want you to take away is that thyroid eye disease, although scary, because it can change how you appear, change how you feel, and can be potentially blinding, is 100% totally manageable. Nobody has to be disfigured from thyroid eye disease. Nobody has to go blind from it. Thyroid eye disease can be totally managed. There you go. In 3 to 5 minutes, what you really need to know about thyroid eye disease.